my name is Britni Maher. I'm a physical therapist at Motion at our Red Mill Clinic, and today I'm going to be talking to you about dry needling, what we do, why we use dry needling to treat certain impairments, and then we'll do a little bit of a demonstration. Dry needling is a tool that specially trained physical therapists can use to treat trigger points in muscles. Trigger points are a contracted part of a muscle that won't release, and they form basically a knot. This knot causes pain, which can refer pain to other areas in your body. It causes decreased strength, limits range of motion, and can also cause an increase in tenderness in the area or in the referred area. So we use a needle. It's a thin, solid filament needle that is inserted into the trigger point, and that causes a twitch response. This twitch is kind of like a spasm of the muscle, and that forces the muscle to reset or release, and then the knot is gone, and that way your muscle can then function as one unit. Dry needling is used to reset the muscle and kind of make a change so there's less pain and improved mobility and function. Usually, to get the most benefits, we need a cumulative effect, so your therapist may needle the same muscle or group of muscles over several visits. Some of the side effects are soreness, possibly increased tenderness in the area, but we treat that with gentle stretches, ice, and kind of rest. The soreness feels like the muscle just had a really strong workout, so you can kind of expect that fatigued, sore, almost painful feeling. But after that soreness goes away, most patients see a benefit after the first visit, and that can include decreased pain and increased range of motion. Today we're going to needle Erica's upper trap. So I'm going to palpate for a trigger point, which will be a hyper-irritable spot. I feel one right here. You can kind of see my fingers rolling over it. I will insert the needle. And you can see these twitches. This is called a local twitch response. So this is the trigger point releasing. And that's it. So we'll typically needle a few trigger points in the same muscle and then have Erica do a few gentle stretches, followed up by some ice that she'll repeat throughout the day. She can expect some soreness for a couple of hours, up to 2 days. And then once the soreness goes away, she should start to feel some of the benefits of the needling. In a typical dry needling session, I would needle several trigger points in the same muscle or possibly a group of muscles. Erica can expect to feel sore, so afterwards I would have her do some gentle stretches. We'd put some ice over the area, and then once the soreness goes away, usually after maybe a few hours up to a couple of days, she should start to notice some of the benefits from the dry needling. As runners, you all probably have a lot of trigger points in your calf muscles, possibly up into your thighs and even your hips. And those trigger points can really be limiting your performance or preventing you from reaching that PR. So if you're interested, check out our website for a list of all of our locations that offer dry needling at Secours in Motion.com, or come see me, Britni, in Red Mill.